Perfect. Hello, everyone. My name is Selena,
And I'm Emily.
and we're master students in Dr. Adam Rudner's lab at the University of Ottawa. Today, we'll be walking you through our work on bacteriophages infecting S. epidermidis for use in phage therapy.
So, in February of 2024, a clinical trial took place at the Ottawa Hospital led by Dr. Marissa Azad, who's actually our keynote speaker for Friday morning. And in this case, a 79-year-old patient had presented with a devastating infection where the bacterium Staph epidermidis had colonized her prosthetic implant, spreading an infection throughout the body. The patient had undergone 10 major surgeries, numerous rounds of antibiotics, and had ultimately developed sepsis. And with all other options exhausted, Dr. Azad turned to phage therapy. So this case was the first of its kind in Canada, and it was deemed a success, and a year later, the patient is doing well.
So the main culprit of these prosthetic joint infections is Staphylococcus epidermidis, which is a common commensal of our skin and has several beneficial roles, including protection against other bacteria like C. acnes. However, in medical settings, S. epi can colonize on the surface of the medical devices, causing chronic infections.
So the main virulence factor for Staph epi is its propensity to form biofilms on these implanted surfaces. So biofilms are structural communities of bacteria which are far more robust, disperse easily, and are often highly antibiotic resistant. However, phages present a promising solution against these biofilms. They can target different receptors and penetrate through the layers more effectively than antibiotics, often due to the activity of depolymerases and endolysins. So as you can see in this image, these biofilms form through the accumulation of cells within this slimy matrix,
C'est
and within
parti.
oh, and within with the addition of phage,
Non,
these
ça s'est
biofilms
bien passé. Enfin, je sais pas, en fait, moi j'ai vraiment l'impression d'avoir.
um, within the sorry. With the addition of phage, these biofilms can be cleared to a level where the immune system and adjuvant treatments can work more effectively.
Now, the current availability of SEPI phages is quite limited, presenting a hurdle for future phage trials against this pathogen. In one of the most recent collections, consisting of 205 staphylococcal phages, only 15 of them were able to infect SEPI. And unlike the broad spectrum nature of antibiotics, phages are incredibly specific to their host. So, in a clinical setting, many phages may need to be tested before a successful one is actually found. And this requires a broad and diverse collection to screen from. And this is the objective of our project.
So the first aims of this project were to develop a method for isolation of novel phages, and as phages are found where their host bacteria live, we did this through the direct isolation from skin swab samples from healthy volunteers. And so since May of 2024, we've isolated more than 80 phages from nearly 200 volunteers across 12 staphylococcal strains.
Then we collaborated with Dr. Patrick Lipashevsky and Brenna Fox from McGill University, who will be speaking tomorrow morning, so make sure to tune in. And we have utilized their novel library prep that allowed us to sequence some of our phages directly from plaques using nanopore technology. Now, preliminary results of partial genomes allowed us to compare these phages to existing collections. We have found phages matching to 3 of the 4 known clusters, B, C, and D, all with high query coverage and percent identity. And we're actually particularly interested in cluster C myoviridae phages as they've been shown in the literature to be therapeutically safe and effective, although we have not found any cluster A potoviruses yet.
So lastly, we wanted to test if our phages could clear biofilms in vitro. So in this experiment, biofilms are formed over 18 hours in a 24-well plate where some wells are treated with phage. Planktonic cells are removed through washing, and the remaining biofilm is stained with crystal violet dye. So this experiment allows visualization of phage activity in preventing biofilm formation, where the level of dye remaining corresponds to the amount of biofilm remaining. So here we have phage causer, which is a phage that doesn't infect the strain we used. It's used as a negative control, as well as the MOI of 0, where no phage is added. And we can see in both that the biofilm is fully formed. And this is used to compare efficacy of various phages. So as you can see, phage feeder is quite effective at all 3 MOIs, whereas Lofaro is maybe not so effective at lower phage concentration.
So in the future, we hope to further characterize our phages through obtaining full genome sequences and testing their efficacy against pathogenic isolates from patients with prosthetic joint infections. This way, we can ensure that the next time a patient enters the clinic and phage therapy is used, there's an extensive collection of characterized phages available for screening.
So this work would not be done without the support of our lab members and our funding sources.
Thank you
Thank
for
you for
listening.
listening.